I was sent this CT scan to offer some options, and the guy that's working this up had some questions. So essentially, tooth number 27, which is here, is no good, and it needs to be extracted. And they want to replace 27, 28, 29, and 30 with implants. And they're looking at 3 implants, possibly 2 implants. So we'll look at that. And also, they kind of worked up this lower left segment and this upper segment here. So a couple different things is one of the things that they were thinking was make a 4-unit bridge from 27 to 30, split the difference between 28 and 29, and place the implant in the middle. Restoratively, this is going to be it's not going to look right. So a better option would be to take this implant and move it back and have a 3-unit bridge from 27 to 29 and a standalone implant crown on 30, or move it forward and essentially have a 3-unit bridge going distally and a single tooth implant crown here. So essentially what I look for is bone volume to see which one gives us better options restoratively to work up this case. So given the implants that are placed in this dimension, the implants are too close to implant 27 if this is where it belongs prosthetically. And if we push it back to this area, it looks like it's farther away. So in this patient for this situation, and it doesn't always work out like that, prosthetically and surgically, it's going to be a little bit easier to place an implant in 27, 29, and do a 3-unit bridge and have a standalone implant crown. And you can also splint this whole entire thing. Would it be possible to just place one implant in the anterior segment, 27 and 30, and make a 4-unit bridge? That could work out too. I've done it once or twice before. I don't see any issues with that. Choosing the implant sizes for this dimension. For a canine tooth, this was a 3.5 occlusal diameter by 11.5. I would replace this implant with a larger diameter implant, something like a 4.5 or 4.3 by 13 or something like that. Just get a bigger, nice size implant, place it a little bit subcrestal since the platform switched implant. And on this implant, this is a 5.0 by 10. I think this is more than sufficient for this area. And again, you could do a 4-unit bridge here. These are 2 really nice size implants. Or you can go back and incorporate this implant for a 4-unit bridge. Again, this is a 3.5 by 10. I'd probably replace it to a 4.3 by 10. So changing the angle, this is I would change this angle. See how it's coming out a little far buccally as compared to the buccal. I would just change this angle dimension more along like this, and we'll look at that prosthetically. Let's see, go to surfaces, isolate the lower jaw, and then turn off the top teeth. So we'll click on right first premolar. Is that right? No. Let's see. Right maxillary. We'll turn all those off. Left maxillary. Keep the mandibulars on. Okay. So looking at this again, I think this would be fine. Go back into surfaces, click on our original model, and change the translucency. And also change this mandibular translucency. Or transparency. There we go. So something like this. You can even scoot this implant back a little bit more. There we go. So I'd be happier with that. And then the only other thing I wanted to bring up was in this panoramic view, when you turn on all the teeth, This tooth, or these teeth right here are, let's take a look. They're medium, so I just change the sizes to large on all 3 teeth. Replace tooth, large. Replace tooth. I didn't click on it. Let's see. Tooth, replace tooth, large. Go back. There we go. Replace tooth. Go to large. And then scoot this this tooth in a little bit, change this angle, and it'll have a better look restoratively. All right, so in cross section, this is more than fine. Something like this. And then this premolar here. This is a 4.3 by 10. I would just increase this to a 11.5 or 13. You have the room for it. There's the nerve, so maybe back up to 11.5. And there you go. From here on out, you can just make your surgical guides. But this, to me, would be sufficient for the mandible on both sides. And then you can start looking at placing implants on the top. For here, you can place a single implant here, a single implant here, and single implant here for those teeth. So turning on all the implants and turning on all the teeth restoratively, it would look something like this without this one implant. And then get rid of that. Let's see. Remove. And that's it. Let me know if you have any questions.